when your child is that sick and you're just trying to do everything you can to help them, feel better and thrive where they're at because there's really not, a lot of choices when you're on dialysis of what you can do to help treat kidney disease, right? And so I just didn't know how bad it was until he felt better.
I saw it at the hand washing station at the entrance of the NICU. I see it in the playroom during medical play bingo. I see it near the fish tank in the surgery waiting room. There is a powerful unspoken language between two parents who have never met, but know in their deepest soul what the inside of a children's hospital feels like. It is joy and it is grief. It is love and it is fear. It is miracles and it is loss. This podcast exists to tell these stories. I'm Katie Taylor, a very proud child life specialist, and it is my honor to be your host of Inside the Children's Hospital.
Lyndsey, I was looking at our podcast history together, and I guess it'll be our fourth time recording together, but
Yes.
our second time of talking about your experience with what James has gone through. But we started out the podcast, you and I years ago where we didn't even know each other yet,
I
and you talked
know.
about your daughter's experience. And then I came to your house once and we recorded together,
That
which
was
was
so
so
fun.
fun. And now we talked about Jamesy the first time, and we're going to continue on with that story. So get us all up to date on how y'all are doing, what is going on, and just give us an update about you.
Yeah, no, absolutely. It's been a whirlwind of the last, I think it was like almost 2 years ago that I recorded James's first part of his story with you, Katie. And so now are wildly different in so many good ways. So James did get a kidney transplant, and we'll get into all of that.
Yeah,
Um,
we can't bury the lead.
I know I can't bury the lead. So things have been way, way, way better for all of us and our entire family. When a child, I feel like, is sick, it doesn't just impact that child, it impacts obviously us as parents and our own other kiddos and even our extended family members and friends. It kind of impacts all of those relationships. And so it's been kind of nice, knock on wood, for us to get into like a new cadence and a routine as a family. We've been able to travel, to go on lots of mini vacations here in Texas, which if you live in Texas, it's a big state, lots of fun things to do. And so we've taken a lot of small trips, but they've been a lot of fun, lots of memories being made. School just started. And so my oldest just went off to middle school. And then my oldest girl, Vivian, she started fourth grade. And then Liliana is in kindergarten now. And James is still at home with me. So I still have one home with me. And so life is, it's beautiful. It's been just so amazing to see the difference it has made in our lives for him to get this kidney transplant. So I'm excited to share more.
Yes, me too. And it's been a privilege to know you and to kind of be with you over the past 2 years, but I know for sure that I will learn things today that even I didn't know. And you're an amazing mom and you're such an advocate, and how you find time to be there for your 4 kids, to be such an amazing part of Child Life on Call. For those of you who don't know, Lindsay listens, edits, produces, and publishes every single podcast that we have here. And because of that, I've always like tried to make sure you are in a good headspace to do that, because it can be heavy listening to the same thing and be a little retriggering and all of that, but you handle it so, so well. So why don't you take us back to where we left off the last time 2 years ago?
Yeah, well, where we left off last time 2 years ago, we were just starting the testing process to find a living donor for James. And so we had a few family members come forward, and surprisingly enough to everybody, one of them was a match.
Before we get started on that journey,
Yeah.
I should have asked you the question. Give us a Cliff Notes version of James's story since birth for those who
Oh,
didn't get to listen to the first episode.
yes, I can absolutely do that. So, Cliff Notes version of James's story is I had a pretty normal pregnancy all the way up until 20 weeks when they discovered that his kidneys appeared to have hydrophenosis. And so That is just swelling of the kidneys. They just didn't look like they should. And so they were like, "Okay, well, you need to come back weekly now. Like, don't be nervous, but like, we're gonna just monitor this closely." Everything looked good, and then all of a sudden, it did not. And so at that point, we were referred to a fetal care specialist, and they kind of let us know different options we had. And then, they kind of painted this picture. They didn't know like what it was going to look like. I mean, the doctor was like, I wish I could look into a crystal ball and tell you what the outcome is going to be, but here are like the different, things that could happen. And, he was born a month before his due date. He was a month early and before his scheduled C-section, which that is a whole story in itself.
Yeah.
And he came out crying, which was incredible in itself. And then not too long after he was born, once they got him stabilized, he was transferred to a level 4 NICU, and he spent about 160 days between the NICU and the PICU, most of it being in the PICU. And so huge shout out to our PICU family at Dell Children's. If you're listening to this, we love y'all and miss y'all, but glad we have not seen you.
Love you, miss you. Hope I only see you in the grocery store.
Exactly, exactly. And so he spent a lot of time on continuous hemodialysis, which slowly pulls off fluid, cleans out the blood, all of that stuff. He got discharged. He actually was doing really well, and then he unfortunately had developed an abscess and had to be readmitted to the PICU and was on CKRT again for about 100 days. Got discharged, and then when we were talking the last time, he had just dealt with a hernia, and he was back on hemodialysis again, and we were just starting that testing process, and so after all of that, so that's kind of like the catch-up version, right, of everything that
Right.
happened, and then not too long after that, he ended up getting his hemodialysis catheter removed, and, he had low blood pressure, so his body was just telling us it was time to be done with that. He just could not handle it, and so on that same I don't even know if I told you this, on that same day that they took out that hemodialysis catheter, we got the phone call saying that they had had their review process, and so what that looks like is they have a team of doctors, the transplant coordinators, really hospital from the adult hospital and the pediatric hospital looking at all of the scans, all of the information, and that's the day they called me to tell me that he was a match to his aunt. And
Amazing.
so that was really, really incredible news. And so from that point, we were discharged to go home, started back up on peritoneal dialysis again. And so peritoneal dialysis is where they basically fill the abdomen with fluid and it pulls off additional fluid out of the abdomen. So it's kind of like a balance fill type of situation. But it is fairly easy to do at home, lots of steps. So he was at home doing that, and we started to have problems again. And I don't know if you remember this, but it was a very difficult time leading up to the time we found out we had a match to the time he was able to have the surgery because they have to coordinate between two hospitals, right? You have the adult
Yeah.
hospital, pediatric hospital. We found a
'Cause
date
the
that
the adult hospital is the one that takes care of the donor,
correct.
right? Yeah.
Mhm. So we had to make sure everything lined up there. And then in addition to that, they had requirements for his donor. She was phenomenal. And they do have strict requirements on different things. I tried to be a donor for him, but because I had gestational diabetes, that was an automatic no.
Oh,
I'm at higher risk for developing, I guess, diabetes as I get older. So I don't know if I'll ever be able to be one, but I guess it's different from center to center. So
yeah.
I always tell people, just ask questions, just ask.
Yeah.
You just never know. Um, and so we got to the point that summer before his transplant where we had to dial back on his dialysis because it was causing his abdomen to like swell and he had developed another hernia in his belly button region. I felt like we were running on borrowed time from
Yeah.
about the end of June to September
Yeah.
until we made it to his transplant date. And for those of you that don't know, we actually had to relocate, to Houston for probably a lot longer than we had anticipated, and I'll get into get into why about that here shortly. But we had to basically relocate to Houston for a few months just to get him the transplant because that's where his transplant center was at Texas Children's. Big, big city in Houston. Definitely different vibe than Austin.
Yeah.
Um,
The first day, wasn't your car broken into or something? Do you remember that?
yeah, it was like the first week we were there.
Yeah.
And yes, I went up to my car and there was stuff. I was like, oh no, this is not good. But I generally felt fairly safe there, but I was
Yes.
like, "This is not any way no one wants to
It
start
was
this
just
out."
one of those things, Linz, where of everything you had going on, and huge shout out to, the organization that provided your housing
Yes,
during that transplant process.
CTI, Children's Transplant Initiative. We had them on earlier this year. Yeah,
They were such a phenomenal family who had also had a child with a transplant, and so now they provide housing. So you guys kind of got to go and navigate. Hey, Jamesy. Um, you got to go and it just connected you to an immediate community and a place to feel safe.
it really did. It was a safe landing space is what I like to call it. We felt so loved and cared about immediately. We connected with Cheryl and her husband Ross pretty quickly. And they brought us, like, this welcome bag, and we literally felt, like, right at home. So, it was just really nice to have that. Looking back, especially not even knowing how long we were gonna be in the hospital for. So, it ended up being a huge blessing to our family, during that time. So, it was just incredible to have that space, and the kids still call it the Houston house.
The Houston house, I love it.
Yes, the kids loved spending time there. We had lots of memories, just fun fun things we did just to make the time pass the time.
Because that's the other thing about relocating for an extended period of time is that you have children here in school in Austin and navigating who's going to care for them, which of the kids are going to come with you because Liliana is not in school full time and all
Right.
of that.
Right, my in-laws were such a huge help to us, and they still are today. They just are very involved in the kids' lives, and Grammy and Grampy, I should say, is
Grammy and Grampy.
they're lovingly called, and so they spent a lot of time with them during that time, and so, his transplant was on September 13th of 2023. So
Wow.
that two-year anniversary is coming up soon.
So soon.
Whew.
Let's go back to the workup before transplant and what that inpatient stay looks like.
Yeah, so it was a pretty intense couple of days. They were so wonderful about, like, coordinating everything to where we were only there for, like, 2 or 3 days, but it was like a 8 to 5, like, there's no downtime. It's like, "Okay,
Yeah.
you're going to CT from 8 to 9:30, and then at 10 o'clock, you're gonna come to the renal floor, and you're gonna meet everybody." So that was really nice. They had everybody kinda come to us, so we got to meet the surgeon, the dietitian, the child life specialist, Julie,
Hi,
and,
Julie. We've interviewed her too on the
yes.
podcast, and she's
Shout out to
wonderful.
her, we miss her. And so everyone just kinda came to us, and that was really great, having a sick toddler at the time was hard. And so it was just kind of back-to-back appointments, different scans, different testing. I mean, he even had to get X-rays to look at his bones to make sure that they were good. They looked at his arteries in his body to make sure the donor arteries and his arteries would fit okay. So there's just a lot of, little things they looked at during that time. We had to basically get a check off from, like, every department.
Yeah, and so you're like, "I'm gonna be really nice to these people so they help
Yes,
us out."
yes, exactly.
How long was the actual surgery? And you were also thinking about really your sister-in-law during that time too, because she
I
was the
was.
living donor.
Yes, I was. I was really thinking, about her and everything she was going through. And my husband Alex and I, we were together with James, and then my father-in-law was there to support her. And we kind of just like tag teamed it for the day. The surgery started. She went first. They took her back first, and it was really incredible. During that we asked if they could take a picture of the kidney, and they did. which
Amazing.
was really cool.
I did not know that.
They did, and I think my father-in-law may have walked, with the kidney, like, over because the buildings are connected. So they, like, literally took the kidney out of my amazing, incredible sister-in-law, who I tell her, I'm like, "You're just gonna get random texts for the rest of your life telling you how much we love you and
Oh,
thank you for that ultimate gift and sacrifice you made for James." And so, just huge shout out to anybody who is a living donor or even considers it. Like, that's just
yeah.
yeah, it's just incredible. So, yeah, it's their hospitals are interconnected, and so they, like, took the kidney and walked it on over, and so just as they were starting to open her up, they took him back, and, they have a text message system. They have a text message system, and so we got texts
Amazing.
all day long of kind of what was going on. They took him back, I think, at 7:30, and he didn't get done until 3 or 3:30.
What
Um
was it like during that waiting room? Did you keep your text close by? And but then you also know that it's like that's the waiting period and then it's really game on as soon as he comes out of surgery and you have to be on and ready.
Yes, I'm so glad you brought this up because with my husband's urging, Alex is always so great at keeping me, like, level-headed. He's like, "You know what?" We asked him if it was fine if we could leave. We actually went back to our apartment and
Okay.
spent, like, an hour or 2 there just to, like, break up the time because it's just a long time to wait.
Yeah. Yeah.
And so we, hung out there, watched part of a show. We started a new series, so we were a little bit, find something to distract ourselves.
Yes.
But of course, I'm, like, glued to my phone,
Yeah.
wanting to see all of those updates. But it was kind of a, like, really amazing coincidence that, so Texas Children's has a location in Austin now, and they were preparing to open, and so we were there, and we noticed one of the NPs that used to take care of James at his other hospital there, and we're like, "What are you doing here?" And he was like, "Oh, I'm training. I'm actually training in the PICU today." And we were like, "Oh, can't believe this." And we told him everything that was going on. He was like, "Oh, no way." He's like, "I'm totally gonna be there, to help, with James when he comes out of surgery." And he came out of surgery. It was a lot. Like, it was more than I expected to him to be. Like, he was very, very fussy. Thankfully, they were able to extubate him. Some kids, I guess, have a hard time
Yeah.
being extubated post-transplant surgery. So I was kind of like, trying to mentally prepare for those different
Right.
scenarios. But, he was extubated and, he's very sore. I mean, like, his incision is right across his belly, like, kind of in like a U shape,
Yeah.
upside down U shape. And so, the kidney actually ended up being a little bit bigger than they anticipated, but
Is that a good thing or a bad thing?
well, so, little known fact that I didn't know, they were like, "Well, it kinda matters, like, when you're getting the transplant, but over time, that adult kidney can, like, it shrinks down
Oh,
to fit in
interesting.
the body." Yeah.
Wow.
Yeah. So, I did not know that, and I was like, "Oh, well, that makes sense." So, yes,
Yeah.
I will say, like, the first 2 weeks post-transplant were really intense for him. They wanted him to, like, start moving around, and he's on all kinds of different pain medications, and he was really, really, really fussy, and so we were like, "This is just not like him." He's had lots of surgeries, but they were like, "Yeah, this is a really big surgery, though." And so we just kind of started going through his med list. We were like, "Okay, well, what is he on for what?" And we started going through things, and we were like, "We don't think he's been on this one before," and it was Dilaudid. And so we had them try a different medication, and as soon as we did that, he was so much better. He
Oh,
just was so moody. So we got that part figured out. And so he was in the ICU for I will say about 10 days. And,
yeah.
he had to get an NG tube, which he was
Mm.
not thrilled about. He does have a G tube, but with renal transplants, a lot of times, they just get a lot of, like, juices and bile in their stomach, and the best way to get it out is by placing an NG tube and doing a suction every few hours just to get it out of the body.
Yeah.
So that's kind of what the purpose is for. It's not necessarily always for feeding, but just to remove all of that from their stomachs.
And now a word from our amazing sponsors. We're so grateful to have Payne's Instant Topical Anesthetic Spray as our sponsor of today's podcast. Help control pediatric procedural pain associated with needle procedures and minor surgical procedures while improving patient satisfaction. Payne's Instant Topical Anesthetic Spray works immediately. It is a non-drug and non-flammable topical spray that can be used to temporarily relieve the pain associated with minor surgical procedures and needle procedures. Pain Ease is a medical device and does not contain medication. It can be a safe and effective alternative for lidocaine injections when used to temporarily control pain associated with immunizations, IV starts, blood draws, foreign body removals, and suturing or suture removal, to name a few. Pain Ease works on a 3-step process. First, prepare the site and equipment for the procedure per your facility's protocol. Second, apply Pain Ease by spraying about a can's distance away for 4 to 10 seconds or until the skin begins turning white. Finally, perform the procedure. The anesthetic effect of Pain Ease lasts about 1 minute and can be reapplied as many times as necessary. Refer to application instructions for full details. Important risk and safety information. Consult your pediatrician when using on children 4 years old and younger. Do not use on large areas of damaged skin, puncture wounds, animal bites, or serious wounds. Do not spray in eyes. Overspraying may cause frostbite. Freezing may alter skin pigmentation. Use caution when using product on persons with poor circulation. Apply only to intact oral mucous membranes. Do not use on genital mucous membranes. The thawing process may be painful and freezing may lower resistance to infection and delay healing. If skin irritation develops, discontinue use. Caution: federal law restricts this device to sale by or on the order of a licensed healthcare practitioner. Studies suggest that Pain Ease does not induce vasoconstriction, does not contaminate a site that has been cleansed, and is preferred by patients and practitioners. Pain Ease comes in 2 different spray pattern variations, medium stream and mist. It is also available in 2 sizes, 3.9 ounces or 1 ounce single patient. Gebauer appreciates the care and comfort that you provide to pediatric patients. Visit gebauer.com/Pain Ease with no space to learn how Pain Ease can make visits more comfortable.
From the outside looking in, I kind of saw you treat the experience almost like a job. Like you were there during the hours that the doctors were there, you were taking notes, very much an active participant. Would you say that's what it felt like to you? Like you were mom, but you were also like running his care because care teams change and nurses change and you were the consistent presence for him.
Yeah, it was a lot like that because it was our first time being at this hospital, on top of it being
Yeah.
the transplant, so we didn't know anybody. Like, it
Yeah.
was just everything was brand new. There's brand new nurses, brand new doctors, getting to know everybody, but we became pretty comfortable with everybody quickly, but I will say that I had that hat on because I was like, "Okay, we just really need to be on top of everything," and I'm glad that I did because probably about a couple days, it was like 2 or 3 days after we moved from the ICU to the floor, he still just wasn't having a lot of mobility, and so they were becoming concerned that he maybe had an ileus, which that's a common post-transplant, complication, and remind me, an ileus, isn't that, like, when your bowel, like, goes to sleep or
Yeah. Yeah.
I forget everything. Hi, James. And so they thought that's what it might be, and it wasn't, and they did several X-rays. And one of our friends had recently been transplanted, and they had a complication called chylosocites, and their son's abdomen was just swelling and swelling, and, like, they weren't giving him very much food, right? And same thing with James. We were only giving him, like, 10 mLs an hour,
Yeah.
and we're like, something just is not adding up." And James's abdomen kept getting bigger and bigger, and everyone was like, "We've never," like, they were being, like, very, like, "We gotta figure this out," like, very investigative, you
Yeah.
know, and then I brought it up. I was like,
Yeah.
"Well, could this be a possibility? Could he have a chylus leak?" I was like, "I don't know much about it," but I was kind of explaining my friend's situation, and they were like, "Well, you know what? I think that's a really great idea. I think we should go in and, do a tap of the abdomen," and they were gonna check some other things out too, because they were concerned that it could have been a urine leak, which that's
Mhm.
even a more a more
Yeah.
rare complication and a not good one. So we were really praying hard that that was not the case because that would have been devastating. And so they went in, and sure enough, it was a chylus leak.
Wow.
And so with that, he had to have it. a drain installed in his abdomen to just every, like, 4 hours, they would go in and take it off, and then they would replace, with an albumin infusion, which that is, like, a certain type of protein that your body makes that you need to just, sustain. And so he was given that along with TPN. So he was kind of off feeds for, I would probably say, almost a month.
Yeah.
And so he ended up being inpatient for 60 days.
Wow.
And
And what
so
did they what was the preparation like if things had gone typically?
typically it's usually about, for kiddos this age, about 2 weeks. You're
Wow.
inpatient.
Which is impressive in itself.
It
Like
is.
you
And
can get a new kidney and then go home in 2
I
weeks.
know, it's so crazy. And I've even seen kids go home in like a week. And I'm like, wow, that's incredible.
With the Kyla's leak though, you had to stay on that. Like you would tell us like the updates of how it looked that day and like
Oh,
how much
yes.
was coming out and yeah.
Yeah, it was like a pink color at first, and then it turned to yellow, and then once it turned to like a milky white, that's kind of when it's like a sign that it's becoming over, like it's starting to heal a little bit. And so then we just left the drain open, and then they eventually took it out, but we had to have another one placed, and it was a big there was just a lot going on at that
Well,
time.
and talk about like mobility. Like James is at the time, he was 2.
Mhm.
And so y'all did a lot of Bluey. You
Yes, we did a
did
lot of Bluey.
a lot of like, would PT, OT, child life come by?
Yes, everybody would come by. We'd have PT, speech, and OT come by. PT obviously was definitely the hardest.
Yeah,
But I will say, like, one of the things that we noticed right away is and a big change as soon as he started to feel better was his color was just different. And I went back and looked at old photos of him just from a few weeks ago, and his color looked he just looked so sick. And I didn't
yeah,
realize like how sick he was until he was better.
yeah. Oh,
So,
and
that was kind of like a hard realization. I was like, you're just in it so much when your child is that sick and you're just trying to do everything you can to help them, feel better and thrive where they're at because there's really not, a lot of choices when you're on dialysis of what you can do to help treat kidney disease, right? And so I just didn't know how bad it was until he felt better.
yeah, that was one of the coolest things to see from the outside perspective is you getting to watch him become this little boy.
Yes, becoming this little boy who's just happy go lucky and just he loves being outside. So before his transplant, he did not like being outside at all. He would cry and be upset. And my amazing sister-in-law, she loves being outside in the nature. And they say sometimes that
Get out of
donors
here.
can give recipients. There's a lot of chatter about that in like the whether it's a heart or whatever it is, they maybe pass along some traits or things that they
That
like.
gives me chill bumps. It makes me wanna cry. I love that.
Yeah, he loves being outside, he loves being in the water. He could not take a bath or a shower or have any of those experiences basically until after his transplant because before his transplant, he had so many infections. It just really wasn't a great option for him.
Right. Oh my gosh. I feel like we've covered so much, but I still have more questions.
Yeah.
Looking back for how you handled, um, I don't know if handled is the right words, but how you navigated like the stress of transplant and feeling like you had to be there and your other kids at home and being able to sleep at night so that you could confidently talk to the doctor. Talk to us a little bit about that.
It was definitely a juggling act. Like I said, I couldn't do it without my husband or my in-laws. We kind of tag teamed it. My husband went back home and he was, managing things at home while I was in Houston doing things. And so, just really trying to prioritize sleeping
Yeah.
and eating and really just staying there from, having my certain times, like going in at 8 a.m. and leaving at, 5:30 unless something, was drastically going wrong because it was really important for me to have a routine where I, went home, made dinner, even if it was just by myself,
Yeah.
FaceTime the kids, see how their day was going, just kind of come up with like a new routine from when we were gone and what that looked like. And just really, trying to have some sort of for me, routine is a big deal, right? So just having some
Yeah.
sort of routine that felt good. And I would call every night to check on him, of course. I think the big peace of mind was that I was right around the corner. So if I
Yeah.
needed to go up there, I could drive up there, and be there in like 3 or 4 minutes. So if there was ever an emergency, I could just be there in a
Yeah.
heartbeat. So that I think that really gave me a lot of peace, being able to take that time to go decompress after the day and, just find moments of peace. As being in the hospital, it's just really busy.
When you, were finally discharged from the hospital, it didn't mean you got to come home. And I remember you had those weeks of just being close by because the team wanted him close by.
Yeah, so they wanted to monitor him for about a month post discharge. And it ended up being 6 weeks. So we got discharged. I want to say it was at the beginning of November. And then we did get to go home for a week during
Yes.
Thanksgiving, which was nice. And then I took Liliana with me, and she stayed with me for like the last 3 or 4 weeks, I guess.
Yeah.
And so those last 3 or 4 weeks were really hard because
Yeah.
we just didn't have a date yet on when we could go home, and we were waiting for his tacro levels to kind of level out, and so tacrolimus is one of the main anti-rejection medications, and it's really important that it stays in range because then it can cause rejection, if it's not in range, or it can become toxic if it's too high. So if it's too low, it's bad, and if it's too high, it's bad, and so just really getting it to be stable. And then also just making sure that he was able to tolerate his new formula. So with a Kylus leak, you have to go on a non-fat diet for 6 months post. So he is still 100% G-tube fed, so that was kind of a blessing in disguise at the time because we could, control what he was eating. But that is kind of a little bit of what kept us there was that Kylus leak and then monitoring those levels.
One of the misconceptions with transplants a lot is that, especially to the outside world, is that now James is cured. He has a
Exactly.
new kidney, but that's not the case at all, right? And you're
No.
still navigating so much after transplant. Like, yes, there's so many good things that come with it, but it's still a medical journey.
Yes, it does not end at transplant. I can't tell you how much it's changed his life. It's just been incredible to see. He barely laughed or smiled before his transplant, and now he's like laughing and happy all day long. So it's just great to see how much has just impacted his spirit, not just like his physical body, but like you can tell it just makes him happy to feel good. And so, like you said, a journey just does not end at transplant. About a year ago, he had a biopsy. So at our center, they do biopsies at 6 months and 12 months. And then at the 12-month biopsy, we found out he was rejecting his kidney. And so that was a whole new level of stress that I could have never imagined. But now we're kind of on the other side of that. He had to have some treatments. He had plasmapheresis, which I'm like, oh man, we have put almost
Yeah.
everything on our book, but that is basically where they pull all the blood out of your body, take the plasma out, and then give you new plasma in your body. They sometimes call the plasma exchange or plex, sometimes is the other word they like to use in the hospital. But he had about 5 rounds of that, and he had IVIG and Rituxan, and so now, we're monitoring it monthly, and he gets infusions right now monthly. So that was definitely not something we expected, but the good news is that after 9 months, we're starting to see some change in his levels, which is really reassuring. So we're really excited to have some progress in that area.
That's amazing. And I remember it was hard when the rejection came up because you had to go back to Houston. And, like, for the
Was.
kids at home, it's like, "Wait, or do we have to," because their memory was of this long stay where mom and James weren't there.
Exactly. It was really hard. I did not handle it well. I mean, we were just everybody was shocked at the
Yeah.
results. And they were basically like, "You gotta come down immediately so we can get this started." Thank kind of a blessing in disguise. He is on blood thinners, and so it takes 48 hours for it to, like, lose its effect. So if he had to have a surgery for this because he did have to have a hemodialysis port placed, in his neck, and so we got to delay it a little bit. So it was kinda nice to have, like, 24 hours to be able to pack and, like, prep for
Yeah,
that.
because
But
they
they
were kind of like, "Get here."
and they were like, "Can you
Right?
come down this afternoon?" And I was like, "Well, first of all," they're like, "Oh, yeah, that's right." And I have to get, everybody else in order before we can, come down there. And then unfortunately, my dad had just come down here to visit us from Minnesota. And so he ended up coming with me though to Houston for a few days, which that was kind of fun to spend time with him there and kind of, show him what hospital life was kind of like. So
Oh, I'm sure he was so happy to be able to be there for you in that way
yes.
after not being able to.
Yes, so that was really great. I feel like in these moments, we have to look for the good, right? Whether it's, the relationships we make or just how it changes our outlook on things. We just have to find the good in no matter what's going on.
Yeah, you're so good at that. You've always been good at that, like, I feel like since I've met you. Where are you guys now, and what is life like right now? So you're doing your monthly infusions, starting to
Mhm.
see things trending in the right way. What is family life like right now?
It is pretty what you would call typical. I mean, we have right now, we've just started back to school. So getting everybody up in the morning, giving everybody breakfast. And after everybody's gone, I start my, morning routine of doing blends now, so I'm starting to do some blends for James. We're still really working on, feeding and eating and things like that, and I'll get into that in a second. But, then I prep all of his meds and his feeds, and we do his first feed of the day. We were doing in-home therapy, and now we're going to a therapy center. And so he's doing feeding therapy, speech therapy, occupational therapy, and physical therapy. And so, when I'm not doing all things child life on call or calling insurance companies, I'm there. So we've been very, very blessed by this new team. And yesterday was a huge celebration because he took 10 drinks of water out of a straw.
That's amazing.
So that's a very exciting to kind of be
That's
heading in
huge progress.
the right direction. And so a lot of times kids who have end-stage renal failure, they throw up a lot just because they're sick, and so James experienced a lot of that, unfortunately, and he has a
Yeah,
really hard time with, like, anything being put in his mouth or near his mouth, and so, it's been really great to see him make a bond with that therapist, and they're starting to, like, make some progress with that, and then, I get home just in time for the bus to get here, and then next week, soccer starts up, and so the 3 big kids are in soccer, and, James loves coming along. He loves being out at the soccer fields, running around and, just being outside. So that's kind of what our typical day looks like right now. So pretty, I
oh,
would
I'll
say
take
pretty
it.
quote unquote normal. So
I love it. And how about you? How are you doing?
I feel like, that you hear the saying like, oh, you're getting your pink back. I feel like I'm starting to get my pink back. It's been, almost 2 years since the transplant. And I'm sleeping better. I feel more rested. And also when you're in the hospital, like you don't eat well. I mean, like
No.
you do the best that you can. And they do have a lot of healthy options, I will say, at the hospitals, whether it's like salads or
But you
different
don't you
things.
don't always want that when you're not
No.
sleeping well, like, you want whatever's gonna help sustain you and
Exactly.
feel comforting.
Exactly. I think just also finding time to do the things that I love and remind me of who I am because I am a caregiver and I'm very proud to do that and be that person for my son. But it's also important to find things that remind you of who you are before all of this started. So I really like to read. I like to bake. I need to get out my keyboard. I like to play piano. So I haven't done that in a while. So it's kind of on my list now since the kids have gone back to school. Just trying to find time to squeeze that in when I can. But I just think it's really important to do things that fill your cup and make you feel like you're you again.
I love it. Well, I'm so grateful to have you in my life and to have you a part of this team, and I love you dearly, and James and everybody.
The feeling is mutual. I'm just so glad that we met. I don't know how many years ago now, 7 years ago, 8 years ago.
It's amazing.
But yeah, no, it's been a wild ride, and I'm glad to have you in my life and to show me all the child life tips and tricks, and people are always like, "How do you know that?" I'm like, "Well, I know a pretty amazing lady named Katie Taylor who happens to own Child Life on Call, and she has a lot of experience, knowledge about how to help people cope, parents, children cope." Even yesterday, I was so proud because Liliana came home and she found the squishy toy and she was like, "Okay, if I squish it flat, that means that I'm feeling a little nervous about school. And then if I squish it this way, it means that I'm feeling excited about school." And I love that I can just see like the things that you've taught me in my own children and the way that they're
Oh,
coping with things.
that's so sweet. I feel the same way. Like, I feel like you're such a good balance to this because you offer so much insight and expertise and keep us so grounded into what we're trying to do here. And you do it so generously. So I love you.
For those of you who are joining us today, I am not a doctor. I'm not a therapist. I am a child life specialist. And the suggestions and tips and resources that I talk about with parents on this podcast may be great for you and they may not be right for you. So, the most important person you can talk to about getting support is your care team, your doctor who knows your story and your child's story. So, regardless of maybe what I mention or what other families mention here, we're not licensed therapists, we're not doctors. We're having a conversation about what the parenting journey has been like. So, please keep that in mind as you listen today.